Topic 4. Health. Health services in the United States. It is important to take care of your health and understand how the healthcare system works in the United States. Health services in the United States are not free and can be very expensive. Refugees can receive help paying for health care through programs called Medicaid and Refugee Medical Assistance. Medicaid. Medicaid is a medical assistance program that helps families with little money pay for some or all of their medical bills. Refugee families with children can get Medicaid when they come to the United States. You can also get Medicaid if you are receiving Supplemental Security Income, or SSI. Every state has different requirements for who can get Medicaid. There are different Medicaid plans. You need to pick a plan that works best for you and that has doctors who work near you. Using Medicaid. Your caseworker can help you apply for Medicaid during your first month in the United States. You will receive a card in the mail that you can use at the hospital or doctor's office. Some hospitals and doctors do not accept Medicaid. Call to find out if they accept it before your appointment. Limits on receiving Medicaid. You can receive Medicaid for up to 7 years after you arrive to the United States. It is optional for states' Medicaid programs to cover you more than 7 years. Refugees who do not have children and make too much money may not qualify for Medicaid. Refugee Medical Assistance. If you are not eligible for Medicaid, you may get refugee medical assistance for the first 8 months after you arrive in the United States. After the first 8 months, you will no longer be eligible for refugee medical assistance. Private health insurance. Some individuals and families buy private health insurance through their job or on their own. Private health insurance helps cover a person's medical care costs. A person pays an amount of money each month to the insurance company or has it deducted from a paycheck. If the person becomes sick, the insurance company covers a part of the medical bill. Some hospitals do not accept certain insurance plans, so always ask if they accept your insurance before going. It is a good idea to carry your insurance card and picture identification with you at all times. Health coverage. Health coverage is important to have because health care is very expensive in the United States. If you do not have it and you need to go to the hospital or see a doctor, you will have to pay for all the bills yourself. However, some states have emergency Medicaid, which your caseworker can give you more information about. Doctors and health clinics. A doctor's office or health clinic is where you go if you feel sick or if you need health services like vaccinations or blood tests. Most doctor's offices and clinics ask that you call to make an appointment. However, some clinics may have walk-in services. Hospitals. A hospital is where you go if you feel very sick, if your doctor sends you there for tests or surgery, or if you have a medical emergency. A medical emergency is an extreme and sudden health problem. For example, losing consciousness, having signs of a heart attack, or experiencing sudden and severe pain. Routine medical exams. It is important that you and your family go to the doctor once a year for a routine medical exam or checkup. The doctor will examine you even if you feel healthy. Some diseases or cancers may be found before they become serious. Seeing the doctor. When you visit the doctor, it is very important to tell the doctor how you feel and that you understand what the doctor is saying. If you have limited English skills, the doctor, clinic, or hospital should provide interpretation services. It is your right to ask for an interpreter to help you communicate with the doctor. Using an interpreter. The interpreter is not allowed to share the information you and your doctor discuss with anyone else. This information is confidential. Avoid using children as interpreters as some information may be inappropriate for them to hear. Seeing the doctor. If you do not understand the doctor, you should ask the doctor or interpreter to repeat what they are saying. Do not be afraid to ask questions. Medicine. It is very important that you understand why you are taking medicine, what to do with the medicine the doctor prescribes, how many times a day you need to take the medicine and when to stop taking it, if you need to take the medicine with food, and if the medicine has any side effects. Prescriptions. You will need a doctor's prescription to get your medicine filled at a pharmacy. You might have to pay a fee for the medicine even if you have insurance or Medicaid. This fee is called a copay. Taking medicine. It is important to continue taking your medicine as instructed by your doctor, even if you start to feel better or if you feel worse. If you continue to feel worse, call your doctor. Medicine is not effective if you do not follow the directions correctly, and it may cause your illness to return. Storing medicine. Make sure you store any medicine away from children. Keep it in a locked cabinet or in a place where children cannot get to it. Your health. There are many ways to keep you and your family healthy. These include eating food that is good for you, exercising, visiting the doctor, and having health coverage. Taking care of your health also means thinking about family planning. Family planning. Some couples plan when they want to start a family and have children. Some couples may decide they do not want to have any children. Family planning is a way to control when you get pregnant and how many children you want to have. The man and woman should decide after talking about it together. Birth control. In the United States, you can decide when you want to have children by using certain products called birth control. The use of birth control does not make you infertile or barren. It just controls when you get pregnant. It is important to talk to your doctor about the type of birth control that is right for you. However, no method of birth control is completely guaranteed to prevent pregnancy. Birth control options. There are many birth control options. Condoms are the only type of birth control that help to protect against sexually transmitted diseases such as HIV and AIDS. There are two types of condoms, one for females and one for males. Oral contraceptive is a pill or tablet that is swallowed through the mouth and should be taken daily. Depo-Provera is injected like a shot. Women get the injections every 3 months. NuvaRing is in the shape of a ring and is inserted by the woman into her vagina. It is worn for 3 weeks and taken out for 1 week while the woman is menstruating. After each menstrual cycle, a new ring is used. Intrauterine device, or IUD, is a T-shaped device that is placed inside a woman's womb by a doctor. A diaphragm or cervical cap is in the shape of a cup and placed inside the vagina before sexual intercourse. Getting birth control. You can get birth control from the doctor's office, pharmacy, clinic, or store. Sometimes you need a prescription to buy birth control. Each birth control has a different price. If you have medical insurance, it might cover the expenses. Talk to your doctor about finding assistance for the costs. Birth control. Some women are afraid of taking birth control for the first time because they believe that birth control will permanently prevent a woman from getting pregnant or a man from being able to get a woman pregnant. This is not true. In the United States, birth control is widely used and very safe. You can stop using birth control if you want to have children. Good health for you and your family. Understanding the healthcare system in the United States is necessary for you to access good health care. See a doctor for a routine medical exam once a year. Ask for an interpreter if you do not understand the doctor, and follow instructions for taking medicine. Receiving good health care combined with a good diet and exercise will keep you and your family healthy.